Welcome to Stephen Classes. This is part 3 of Reproductive Health. So in this part 3, we are going to discuss about MTP, STDs and also about infertility. So first of all, about MTP. You know what is MTP? By MTP, we mean the medical termination of pregnancy. So what is the full form of MTP? Medical termination of pregnancy. So we are actually terminating pregnancy before reaching the full term. We are stopping the pregnancy before reaching the full term. You know, the full term of pregnancy will be 9 months. But before reaching these 9 months, pregnancy is stopped or it is terminated. Then that is called medical termination of pregnancy. This is actually a voluntary termination of pregnancy, or it is termination by the knowledge of the person. The person is very much aware about the termination or stopping of this pregnancy. You know, there are involuntary abortions, but this is an induced abortion. So MTP is very much different from involuntary abortions. This is actually an induced abortion. So I repeat, what is MTP? MTP is termination of pregnancy or medical termination of pregnancy before reaching the full term. There are about 45 to 50 million MTPs performed every year in this world, and this is about 1/5 of the total pregnancies. So I repeat, 45 to 50 million MTPs performed in an year, and you can say that this is about 1/5 of the total pregnancies occurring in this world in an year. And you know, MTP is legalized in India. In the case of MTP, it is legalized in 1971 with some strict conditions. There are some strict conditions upon which a person can conduct MTP. So based on conditions only, one can perform MTP. MTP, you know, it is considered to be safe only during the first trimester. What do you mean by the first trimester? The first 3 months or the first 12 weeks of pregnancy is known as the first trimester. So during the first trimester, MTP is supposed to be very safe. Considerably, it is safe. But it will be riskier when we conduct MTP in the second trimester. So in the second trimester, MTPs are supposed to be riskier. So these are the main points you have to note about MTP. Okay. So what is MTP? It is an induced abortion or voluntary termination of pregnancy before reaching the full term. Now, in which condition we perform MTP, or why MTP? What is the significance of this MTP? In which condition we are performing MTP? MTP will be performed to get rid of the unwanted pregnancy, either due to a casual unprotected intercourse. Unprotected means without using a contraceptive, or due to a failure of the contraceptive, or in the condition of a rape. So in these situations, MTP is usually performed. So MTP is performed when there is a casual unprotected intercourse or a failure of a contraceptive which is used, or sometimes situation of a rape. So in these 3 situations, people they depend on MTP. And you know, MTP is also performed according to the recent amendment. MTP is performed when the continuation of the pregnancy is harmful or fatal either to the mother or to the fetus or for both. In that condition only, MTP is allowed. So MTP is essential in which condition? MTP is essential when the continuation of pregnancy is harmful or fatal either to the mother or to the fetus or to both. Okay, so that is about MTP. Now we are going to discuss in detail about STDs. You know what are STDs? STDs are sexually transmitted diseases, or these are the diseases transmitted through sexual contact or sexual intercourse. So the diseases that are transmitted by sexual contact or sexual intercourse, they are known as STDs or sexually transmitted diseases. STDs can be also called venereal diseases or reproductive tract infections. So these are the alternate terms for sexually transmitted diseases. Now we are going to have a classification of these STDs based on the type of pathogen. There are different types of STDs. STDs like gonorrhea caused by Neisseria gonorrhoeae, syphilis caused by Treponema pallidum, genital herpes caused by herpes simplex virus, chlamydiasis, it is caused by Chlamydia trachomatis. Then genital warts caused by human papilloma virus. Trichomoniasis, it is caused by Trichomonas vaginalis. Then hepatitis B, it is caused by hepatitis B virus. And finally, AIDS caused by human immunodeficiency virus or HIV. Here you can see that STDs are caused by different types of pathogens. Some are coming under bacteria, some are viral diseases, and some are protozoan. Here trichomoniasis is the only protozoan disease listed here, trichomoniasis. What about the viral diseases? Viral diseases here are AIDS. AIDS, you know, it is caused by erythrovirus. Then hepatitis B, there is also a viral disease. Then genital warts and genital herpes, they are all viral diseases. And others, you can consider them as the bacterial diseases like gonorrhea, syphilis, chlamydiasis, they are all bacterial diseases. Right. So this is the list of different types of STDs and their causative organisms or pathogens. Right. Now we are going to discuss more about STDs. You know, some STDs like hepatitis B and HIV infection, they are usually transmitted by sharing of the needles. You know, sharing of needle will be done usually in the case of drug abusers. So by sharing of needles, there is possibility of transmission of hepatitis B and also HIV. And also by blood transfusion from infected mother to fetus, these diseases can be transmitted. So I repeat, hepatitis B and HIV, they can be transmitted by different ways. They can be transmitted by sharing of the injection needles or the surgical instruments, by blood transfusion, and also from the infected mother to fetus. So these are the three ways in which hepatitis B and HIV is usually transmitted. Now, another very important point is about the cure of STDs. You know, STDs can be treated and can be completely cured only when they are detected early. So all the STDs can be treated and can be completely cured if detected early, except 3 diseases. You know, these 3 diseases, even if they are detected early, they cannot be treated nor cured, like hepatitis B, genital herpes and HIV infection. So except for these 3 diseases, all other STDs, they can be cured. They can be treated properly once they are diagnosed or detected early. That is a condition. You got it? So that is about the 3 diseases. These 3 are exceptions for that. Okay. Now more about STDs. STDs, what are the early symptoms of STDs? The early symptoms of STDs are itching, fluid discharge, slight pain, swelling, especially in the genital region. So what are the early symptoms of STDs? The early symptoms of STDs include itching, fluid discharge, slight pain, swelling in the genital region. You got it? Now, what will happen if STDs are not detected early, or if they are not treated properly? What will happen? In the case of STDs, when they are not detected early or when they are not treated properly, it will lead to some complications. What are the different complications? The complications are pelvic inflammatory disease. Okay, in the pelvic region there will be inflammation, there will be abortions, stillbirths, ectopic pregnancy. By ectopic pregnancy we mean a tubal pregnancy. Within the fallopian tube there will be pregnancy. Infertility, or sometimes even cancer of the reproductive tract. So these are the things, or these are the complications that will happen when STDs are not detected early or not treated properly. Sometimes due to the social stigma, people, they don't reveal about these STDs. And sometimes, you know, some of these STDs, the symptoms are not visible. They may remain unsymptomatic sometimes. So sometimes it will lead to these complications also. Okay. So what will happen when STDs are not detected early or when not treated properly? This is a very important point. Okay. STDs, they are usually reported very common among adolescent group, especially in the age group of 15 to 24. In that particular age group, the incidence of STDs are mainly reported or very high. The incidence of STDs remain very high in this particular age group. The incidence of STDs, they remain very high in the age group of 15 to 24 years. Okay. Now, how STDs can be prevented? That is another point. How we can prevent STDs? STDs can be prevented by 3 ways. What are the 3 ways in which STDs can be prevented? The first way is by avoiding sex with unknown partners or with multiple partners. So that is one way of avoiding STD. I repeat, avoid sex with unknown partners or with multiple partners. Another way is always by using condoms or barriers during coitus. You know, condoms, they have an added benefit. When you are using condoms, they can also prevent the transmission of STDs. So always use condoms during coitus. That is one way of preventing STDs. Now another way is consulting a physician or a doctor whenever there is a doubt. I repeat, whenever there is a doubt, always we have to approach a qualified doctor. because early detection and early treatment, that is the only way in which we can prevent the spread of STD. So STDs can be prevented by 3 ways. Okay, so these are the 3 ways. I repeat: avoid sex with unknown partners or multiple partners, always use condoms during coitus, then in case of doubt, always consult a doctor, because early detection will give us a chance of a complete cure. So that's about STDs. Now we have another topic. It is about infertility. So we are moving on to our last topic. It is about infertility. Now what do you mean by infertility? By infertility we mean couples they are unable to produce children in spite of unprotected sexual cohabitation. Even though they are living together for a long time, and when they are not using a contraceptive method, even at that time they are not able to produce children. So that condition is called infertility. So couples they are unable to produce children even after unprotected sexual cohabitation. Then we call it as infertility. Now, what are the causes of infertility? For infertility to occur, there are certain causes. The first cause is physical. If there is a physical deformity of a genital organ, there will be possibility of infertility. Then congenital. By congenital we mean by birth itself there are some defects. Then due to some diseases, by using some drugs, by immunological or even sometimes psychological. So all these factors can be responsible for infertility. So infertility, what are the different causes? I repeat: physical, congenital or by birth, by certain diseases, by drugs, immunological causes, or sometimes even psychological. Now here we are going to study about ART. What is ART? By ART we mean assisted reproductive technologies. What do you mean by ART? ART, these are the techniques which will assist infertile couples to have children. So there are certain techniques which will help infertile couples to have children, and these techniques are called ART or assisted reproductive technologies. Now we are going to discuss in detail all the different types of ARTs. The first one is test tube baby program. So here in this picture you can see the method of a test tube baby program. You know, test tube baby program, we can call it as IVF ET. Full form: in vitro fertilization and embryo transfer. So IVF ET, full form: in vitro fertilization and embryo transfer. In vitro mean in laboratory. So in laboratory there will be fertilization. The fusion of the sperm and ovum will happen in laboratory, and after the fusion an embryo will be formed, and that embryo will be transferred. So that is called embryo transfer. So first of all there will be in vitro fertilization, and then there will be embryo transfer. That is why it is called IVF ET, or simply we can call it as test tube baby program. Because of the fertilization happening in the laboratory, we call it as in vitro fertilization, and that is why we name it as the test tube baby program. So here the technique, it is shown here. Here you can see the ovum is isolated. You can see the ovum will be fused with the sperm, and a zygote is formed, and the zygote will develop into an embryonic structure, and this embryonic structure will be transferred sometimes into the uterus, sometimes into the fallopian tube. So there will be an embryo transfer. Okay, so always in the test tube baby program there will be an embryo transfer, but this embryo transfer will differ according to the stage of the embryo. According to the stage of the embryo, we are using two different terms. So we are now going to discuss more about this embryo transfer. You know, one type of embryo transfer is called the SIFT. So what is the meaning of SIFT? SIFT means zygote intra fallopian transfer. That is the full form of SIFT. So it is shown here, embryo transfer. First one is SIFT, zygote intra fallopian transfer. The another method is called IUT. IUT we can call it as intrauterine transfer. So embryo transfer can be done in two ways. One is SIFT and other is IUT. The explanation is given over here. Okay. So SIFT, here the zygote or the early embryo. I repeat, the zygote or early embryo with up to 8 blastomeres. The early embryos, they will contain up to 8 blastomeres. Then they will be transferred into the fallopian tube. So zygote or early embryos up to 8 blastomeres, when they are transferred into the fallopian tube, then we call it as SIFT. So what is the full form of SIFT? Zygote intra fallopian transfer. Then what about IUT or intrauterine transfer? When the embryo is having more than 8 blastomeres. When the embryo is having more than 8 blastomeres, that embryo will be transferred into the uterus. So in order to complete the fetal development, the embryo will be transferred into the uterus. Then the technique is called IUT or intrauterine transfer. So the embryo transfer can be done in two ways. One is by SIFT or by IUT. So based on the stage of the embryo, there are two types of embryo transfer. One is SIFT and other is IUT. So that is about in vitro fertilization and embryo transfer or test tube baby program. Now we move on to the next technique. This is in vivo fertilization and embryo transfer. So there is another method called in vivo fertilization and embryo transfer. What do you mean by in vivo fertilization? Here the fertilization will be conducted not in the laboratory condition, but it will be performed or it will happen within the female itself. So within that person itself, fertilization happens. Then we call it as the in vivo fertilization and embryo transfer. So here embryos formed by in vivo fertilization or fusion of gamete within the female, it can be also used for such transfer to assist those females who cannot conceive. So this is a very good technique for those females who cannot conceive. Okay, so here those females who can produce ova but cannot conceive. There are certain females who can produce ova but cannot conceive. In them, we are using the technique called in vivo fertilization and embryo transfer. So, after the formation of the embryo, that embryo will be taken into another person, into another female's uterus, and that female can be called a surrogate mother. So the embryo will develop inside the womb of another lady, and that lady can be called the surrogate mother. Okay. So here in vivo fertilization and embryo transfer, it is performed or it is helping for those females who can produce ova but cannot conceive. You got it? Now we have the another technique called GIFT. GIFT is called gamete intra fallopian transfer. So here in the case of GIFT, this technique is useful for those females who cannot produce ova but can conceive. So this is opposite condition that of in vivo here. Okay. In the case of GIFT, This is assisting those females who cannot produce ova but can conceive. So gift, what is the technique here? There is transfer of ovum collected from a donor into the fallopian tube of another female. So why this ovum is collected from one lady and taken onto the fallopian tube of the other? It is because this lady cannot produce ova. That is why it is performed like this. So ova collected from one person, that person can be called the donor, will be taken into the fallopian tube of the other lady, and that lady can be called the recipient. Okay, so this is very much helpful for those females who cannot produce ova but can conceive. So that is called gamete intra fallopian transfer. We have the picture for you. So in this picture, in this first picture, you can see the gift. Now we have the other technique, which is called intracytoplasmic sperm injection. This is another technique in which sperm cells will be directly injected into the cytoplasm of the ovum. I repeat, sperm cells are directly injected using a micropipette, using a needle. Sperm cells are directly injected into the cytoplasm of the ovum. That is called Intracytoplasmic sperm injection, or ICSI. So we have the explanation for you. Intracytoplasmic sperm injection. It will form an embryo in the laboratory in which a sperm is directly injected into the ovum. And now we have the last technique of ART. What is that? Artificial insemination. What do you mean by artificial insemination? Here, the semen collected from the husband or from a healthy donor is artificially introduced into the vagina or into the uterus. So, semen will be collected from the husband and it will be artificially introduced into the vagina or into the uterus of the female. So, the male or the husband can be called the donor. So, this is called artificial insemination. You know, in the case of artificial insemination, when the seminal fluid is introduced directly into the uterus, we can call this technique as intrauterine insemination. So, artificial insemination can be called IUI or intrauterine insemination when the seminal fluid is introduced directly into the uterus. Okay. Then in which condition this AI or artificial insemination is performed? Artificial insemination is performed, or it will be useful for those male individuals. I repeat, this is useful for the male individuals who is having inability to inseminate the female. There are some male individuals having inability for inseminating the female, or there are problems concerned with their genital organ or erection of the penis. So they will be unable to inseminate the female. So that is one condition. Another condition, their seminal fluid is lacking enough number of sperm cells, or there will be a low sperm count. So in two conditions, this artificial insemination will be performed. Artificial insemination is performed due to an inability of a male to inseminate the female, or due to low sperm count. You got it? So these are the two conditions in which artificial insemination will be performed. So with this, we conclude the part 3 of reproductive health. So we have discussed 3 parts of this chapter. I hope all of you understood the different topics coming under this very important chapter called reproductive health. So until we meet again with another video, it's goodbye from Stephen Classes.